From the RSNA, this is the Imaging Cancer Podcast, and my name is Dr. Lauren Burkard-Mandel, and I am an R4 diagnostic radiology resident at Case Western Reserve University, University Hospitals in Cleveland, Ohio. Today we are going to explore our topic, women in radiology. Our second guest is Dr. Leah Sieck, who is a dual-trained breast and musculoskeletal radiologist and assistant professor of clinical radiology and imaging sciences at Indiana University. Dr. Sieck was previously an attending breast radiologist at Case Western University Hospitals, where she founded the Women in Radiology group that I'm still a part of today. Dr. Sieck and her passion for women in radiology played a huge role in why I chose Case Western for radiology, as I truly felt that women in radiology would help me find an institution where I felt at home. So thank you so much for joining me today, Dr. Sieck.
Oh my goodness, Lauren, what an introduction. That's so warm and I love it. I think that really speaks to why we are female physicians, we're women in radiology, and how we kind of pass on the love for our profession on to the next generation. I mean, when I think about you and all of the trainees at university hospitals, it was a special feeling in my heart because I think just being able to pass on that legacy and also just show you that you can do it because you're all so bright and talented, and you just need to see women ahead of you in action, and just to tell you that, things aren't perfect. Your life is always going to be chaotic, but you can do it and you can do a lot of good for your patients and for the profession. So I'm just so excited. I'm excited for your future. And it's so great to talk to you and kind of reflect back. So the reason why I started the Women in Radiology group at university hospitals was I was an associate program director, and I saw all of these just dynamic female residents and realized that we all, including the faculty, we need to have time to bond. The faculty need to have venues to mentor our female trainees and give them support. And then there are also systemic issues. Radiology has been predominantly male for so long. Looking back at the numbers, from the 1980s to like 2020s, we are still at about 27, 28, 30% of our profession as practicing radiologists in terms of female radiologists. And we really haven't made a lot of progress forward. We can't say that there's an excuse for that, but I think that it's a problem of our profession that involves both female radiologists advocating for ourselves and also male allies who can lift us up and create space for us and also just amplify our voices, because I think that as female physicians in general, we're cut from the same cloth and we have a lot of drive. We just need to have pathways for professional development, for social support. A lot of us are working moms. I had my kids in med school, and I had one of my children when I was the first year of med school, and I was the only one in my class of 250 who had a child their first year of medical school, which I'm not advocating for, but I did make it through. And there are also other very important reasons why we need women in radiology groups in all of our academic departments where we have trainees. They're also good socially in terms of private practice. I think it's good for female radiologists to get together because there are certain issues that are specifically for women, like having children, maternity leave, juggling family, doctor's appointments, professions. And part of it is that mirroring effect of if you see female mentors ahead of you that are doing it. And, Lauren, I never said that I was perfect. I was always like, I'm just a complete disaster. But you saw how I would just kind of function through the day, do the best that I could for my family, do the best that I could for my patients. And I think that just gives you the lift of like, okay, and you've had 2 children during training, you're about ready to do your fellowship and get a job. And just having that reassurance that, yes, it can be done. As women, we are so creative and we have to multitask. And so, my solution to a personal or professional chaos is going to be different from yours. But just knowing that there are ways of getting through and that you actually can do it, I think that's really the function of women in radiology. And It's actually just a very, for me, I feel it very deeply. When I was going through training, like when I graduated from college in the 1990s, it was like, you can be the mom, you can be the career woman. And yes, you can, but then, how do you pace yourself? And how do you find work life balance? Or how do you have that feeling of like, I can do it when you're, you know, on night float for the second night and for second month in a row, and you're like, oh my gosh, I just want to give this up. So we've all been there and done it, and I think it creates a beautiful community.
Yeah, and I think the modeling aspect of it that you mentioned is so important because as an interviewee, when I was looking for a residency program, I had been a pregnant medical student. I was pregnant at the time, and I felt very much like I was the only one. There was one other medical student in my class who had kids, and he was a non-traditional pathway. He was older, his kids were older, he didn't have little kids. So I didn't want to feel like that again. I knew that I wanted to find a place where I really felt that I would fit in. And knowing that there was a women in radiology group, knowing that there were so many female faculty, seeing female residents, discussing with you that there were other residents that had had families that had been able to accommodate leaves and daycare and absences and things like that. Those were really important things to me. And I know studies are showing that those are really important issues to women of childbearing age everywhere. So this is essential to recruitment, and attracting women to radiology is having, I think, these groups and this kind of transparency of, you can fit in here, because I think medical training can make it sometimes seem like you can't, and like having a family is impossible. And it's hard. It's hard to be a doctor and a mom, but it's not impossible.
Absolutely. And I also think the reason why I made it through my training was also because I had children. So if I had a bad day at work, like super stressful, I went home and there was like sheer happiness. There were these two little beings that were so happy that I came home and, we could cuddle and just have like an uplifting time together. So I do think, it is stressful, but I think there is also a huge benefit, which is it does kind of balance out your life. It also makes you more efficient. You get your job done because you've got something at home that's waiting for you, that's so positive. And I think it's so nice to hear that us meeting helped recruit you to a specific radiology residency program. But I also think that, I hope that all residency programs now, when they interview medical student candidates, are saying all of that stuff, family leave, just the support that they have for people having families, both male and female, having families during training is so important that they just get that all out there so that, especially the female candidates, you may be traveling around with a bunch of men and you're like, I don't want to ask the maternity leave question. But I hope that all of the program directors are just, in their intro are saying all about family leave, about how they support their residents having families, because this is the time for you to have families. I mean, I've had some colleagues who waited till after their training was over and had infertility issues, and that's such a deep pain to have accomplished so much in a career, but you're not able to have the family that you want. So I feel like you, as trainees, you're juggling so much. You have to learn so much, but this is also your time to
Yeah,
become a
your prime
mom. And
childbearing years. Yeah.
exactly. We really need to support that. And jobs need to support that too. At job interviews, the interviewers need to come out and say, this is how we are going to support you, and your family and also your professional development.
Yeah, especially in such a competitive job market. I mean, I think that that's just something that needs to come out up front. To circle back a little bit to kind of creating this women in radiology group, what were resources for you for any listeners who are interested in implementing this in their own institutions or expanding their women in radiology group that might exist? How did you kind of figure out how to structure our group, where I think we had a very good balance and still try to maintain that balance of professional development, but also just bonding and feeling like you have supportive mentors and supportive attendings. There's a good, I think, balance in our group of those two pieces. And I'd love to kind of hear what you modeled that after and where you found help to kind of create that structure.
Absolutely. So I trained at Indiana University, and They have one of the longest running women in radiology groups in the nation. I think they started in 2016 or something. And they also had, at the time, Dr. Valerie Jackson was the, I think, first female program director and then first female chair. And, she's gone on and had just a very luminous career in the Society of Breast Imaging, American Board of Radiology, and RSNA. So they had support when they started. It was actually came from the initiative of some of the residents. And then there have been some key faculty there that have been longstanding faculty mentors. So Dr. Vasantha Aaron, who's nuclear medicine, Dr. Lauren Ladd, who's musculoskeletal imaging, and now Dr. Alicia Capps, who's emergency radiology. So they've had such an involvement from the faculty and such a drive from the faculty and also from the residents. And I think just knowing that they had that kind of a balance of the social bonding, like having like a welcome event every summer for the new residents and getting them all kind of like wrapped up, enclosed in the new system, new job, but knowing that there's support out there from the faculty and their older trainees, senior trainees. And then they do a lot of outreach to minority middle school girls, which has been very innovative and will hold like radiology workshops and ultrasound biopsy experiences and just talk about radiology as a profession, just to demonstrate that women are in a STEM field. So they do that. They do charity work, supporting the Ronald McDonald House. It's interesting, actually, Lauren, that at university hospitals, like we innovated going to the Women in Medicine Summit, which is a multi-specialty female physician professional development conference that is held every year in Chicago. And, so we started that during COVID.
Yep. And we're still doing
And
it. We went this year. We did it this year.
oh, good, because we went too. Oh my gosh, we should have, we'll coordinate better next year. But I just remember, all of the female trainees and interested female faculty, we all got together in the conference room during COVID and got to hear all of the lectures together, talk about them, reflect about them, and just kind of use them to build ourselves up. So I feel like there's so many resources like the Women in Medicine Summit, but even in the ACR, RSNA, AAWR, if you don't have a Women in Radiology group where you are, but you want to start one, there's so many places that you can reach out. Email me, email a female radiology leader, but it just also make it organic. I think we also had some invited speakers who spoke about women in radiology, what's going on with the numbers, how there's still so few women in radiology. That was really eye-opening for our male colleagues to realize the hurdles that we have to go through. What we experience in the reading room may be different than our male colleagues. That the system may be a little bit, we need to put in more energy just, to be there, to show up. We put a lot of pressure on ourselves. We feel like we have to be better to even be seen as equal, just kind of being able to focus on those experiences. And I think that was actually very eye-opening for all of our radiology leaders and kind of help also to pave that support.
It's funny you say that because when we do the Women in Medicine Summit, inevitably every year, because all of the female residents are gone and they're at the summit, inevitably every year, one or several of the male residents message in our chat and they say, "We appreciate you guys so much. We missed you today."
Yes.
Presence in the department is not minimal. So I always think that's really funny too. But I'm really glad you brought up the outreach and the diversity piece because I think that women in radiology plays a really big role also in improving the diversity in radiology, which is another area where we're not doing so great historically and currently. So I was hoping, and you had kind of a big role in diversity and inclusion here at UH, and now I know you do at Indiana as well. So I'd love to kind of hear your thoughts on the role of women in radiology and improving diversity in radiology as well.
So whenever I think about diversity in medicine, I always think of women in radiology and underrepresented groups in medicine or underrepresented groups in radiology. And so that includes not only racial and ethnic groups. We know there are so few Black radiologists, so few Latinx radiologists. And those are actually metrics that we can measure. We do actually measure race, ethnicity, and gender. But if you go back to the JACR, the really seminal articles about diversity in radiology by Dr. Lightfoot, Dr. Makura, Dr. Birch, so many people, Dr. Morgan. So we are measuring race and gender ethnicity. We have no idea about sexual identity of radiologists. We also don't know how to measure, first generation to college, first generation as physicians. There are so many different areas of diversity, and I do feel like it's really interesting, though, when you have a women in radiology group. I feel like the women also being a minority group, I feel like that also opens up the space for other minority interest groups. And I would encourage people to actually start to think about doing that even on a small scale. So we have had such a long-standing women in radiology group at Indiana University. So when I came and started a new role of Chief Diversity Officer, we started a Black radiology interest group, a Latinx radiology interest group, and those groups are really instrumental in going out to regional and national LMSA and SNMA conferences to do med student recruitment. And each group started in a different way. We also have an Asian American radiology interest group. I'm adopted Korean American, and being Asian American in the Midwest, I do feel like a super minority because of where I am located regionally. And so I also felt it was important to support our trainees and faculty who identify as Asian American. And then our LGBTQ group, which was our smallest group to begin with. And I feel like almost like the mightiest group next to women in radiology. People have to come forward and self identify. And we started out with a staff member and a med student and me. And we were like, we're going to do it. And we actually meet the most frequently. We meet like monthly or bi monthly. It's really more of a social group because that was kind of the need in our department, is to just people come together and feel normalized, not feeling like a minority, and just give each other support and also just have a great time together. But out of that came a focus group, which is we have an inclusive radiology focus group studying about transgender patients and gender diverse patients. And we're going to start doing some educational presentations for our department, and then also try to see where we can go with that with patient care. So these are just a lot of different ideas. It all starts with, who's in your department, and just kind of sending out little feelers. And then, because you just never know where you're going to end up. When we started the Women in Radiology group at university hospitals, we already had amazing, dynamic female radiologists there, like Dr. Vasavada, pediatric radiologist, Dr. Donna Plecha, who's now the department chairperson, and Dr. Lena Maida, who's associate dean for Case Western Reserve School of Medicine. I mean, really amazing, accomplished women, and it's just connecting the dots. And like, they have given so much to the female trainees and to the women in radiology group there. So sometimes it's just starting the seed or just putting a little water on it, like growing it a little bit, and then you just kind of go from there and just kind of see what your group needs.
From the strengths you already have. And I think, a
Mhm.
lot of this speaks to the intention, like the required intentionality. I think there's a lot of data out there now that's showing that we can't just like cross our fingers and hope that the diversity in radiology or in medicine or anywhere is going to improve. We really have to be intentional about it. And I think that was something, an idea and a mission that you really brought to us, that we've really continued with. Something we discuss in recruitment and in hiring and all these things. We have these conversations. And I think I remember you saying that, you have to be intentional about it. It's not just going to happen. So, another piece of what you said really speaks to the data showing that when you have diversity in your department of every kind, it improves patient care. And you're saying, you have this now group that's focusing on, transgendered patients and how much those patients must be benefiting from that. So I think that everything you're saying really is like a little microcosm for the truth that we're finding now in all the data in these different avenues. So I think I'm really excited to hear a little bit about that work. And I'm really glad that you were able to join us today. And I really appreciate you and everything that you did for me and for us at UH. And you're really just paving the way here and I'm sure there. And we really appreciate you so much.
Oh, Lauren, I have like tears in my eyes. I mean, honestly, I'm serious because I just felt like I think from my experience, I just wanted to send really a lot of love out. And it's hard when you're in a stressful job, working in a very stressful environment. But I mean, that's always kind of what I come back to, and that's what gives me the passion. And it's so exciting for me to see that started, like that fire burning inside of you too. And I know that, like it's exciting to see you be so successful in your career and going forward. And I know that you will give that back too. And I feel like that's the magic of medicine. And I feel like there's so many reasons why we don't feel that often enough. But I feel like with this kind of work, I don't think people understand that I have so much joy with my job going to these regional or national minority med student conferences and giving a lot of love to the students. And they're so receptive, or just being so fortunate to recruit you to university hospitals. I mean, you're such a catch. We were so thrilled that you matched with us. And it just comes back. It's really like a perfect circle because you give it out, but you also see it come back. So, Lauren, I have to thank you really for creating this moment.
Oh, of course. Thank you so much for joining me today, Dr. Sieck. I appreciate your time so much, and I'm so glad we got to chat a little bit.
This was wonderful. Thank you,
You know,
Lauren.
Thank you for listening to this episode of the Women in Radiology series of the RSNA's Imaging Cancer podcast. Please rate, review, subscribe to the podcast, or check out the journal website for articles on this topic and more.